Joining us tonight, a growing budget shortfall could mean cuts to Nebraska health care.
If passed, LB 261 would slash $4.5 million of funding for health departments across the state. First Alert 6's Philip Katafamo shares how much of an impact the cuts could have on Nebraskans.
As LB 261 makes its way through the legislature, concern is growing about a proposed cut that could impact healthcare departments across the state. If passed, the bill reduces the state health care funds by 37%.
That's funding that they're using, again, for immunizations, for dental health. There's a number of different things that this money goes to support and to directly serve the people in our communities.
$1.9 million of that goes to the Douglas County Health Department alone, which impacts their patients.
A lot of it is salaries for the people who work here. I would say most of that is salary. And, these people are literally doing the work that protects the people who live here. And so if we cut the people who are doing the work can't happen.
Programs like emergency response to natural disasters, free oral health screenings for kids and elders, disease surveillance, and more could all be cut. The bill comes at a time when Nebraska is dealing with a bad flu season and bird flu, along with a measles breakout outside of the state. And with tornado season coming up, a loss of funding presents challenges in responding to these emergencies.
And so, our ability to respond to those things and contain those issues, and also just to make sure that the people here in the community have the protections that they need, that would be definitely challenged if this funding went away.
Dr. Hughes is worried other programs like air quality or health promotions might be lost. She says rural health departments could also be impacted heavily. For many in those communities, their local health department might be the only form of health care available.
So that might be the only place that they have to go get those childhood vaccines. It might be the only place that they have to go get those oral health screenings, or to get, it might be they would have to drive 2 hours to get a blood pressure screening, but the health department is close by, so they're able to, go there for that resource.
Dr. Hughes says her department is looking at other revenue streams, such as grants, to keep programs going if there are cuts. For now, the bill is in committee, so it's still in the early phases. In Omaha, I'm Philip Katafamo, First Alert 6.
On Monday, Dr. Hughes is heading to Lincoln for a hearing to help educate lawmakers on the impact of LB 261. We'll keep you updated as the bill moves through the legislature.